Hi, my name is Shirley Gutkowski, and I'm a dental hygienist speaking to you from my home office. And I wanted to talk a little bit about cavities and what relationship everything has together with decay. So let's talk about the actual word cavity for just a second. A cavity is a hole in a tooth, just like a cavity is a hole in just about everything else. Caries is a bacterial infection that causes cavities, that causes decay of the tooth. The caries infection is almost never addressed in dentistry. It's really not. It's really kind of funny that we just kind of go and drill these areas of decay out. What we're doing with the drill is we're removing the soft part of the tooth, the decayed portion, and then we're trying to reassemble the tooth to a biologically appropriate dimension and use materials that are biologically acceptable to the mouth and the health of the body. So the whole thing is really about how to avoid that hole in the tooth, and by not addressing the decay bacteria, we are missing a huge part of this boat. Holes in the teeth is not caused by a deficiency in fluoride. It's very clear. Fluoride does have a place. I don't want you to leave here thinking that fluoride is worthless, because it does have a place. But you have to address the amount of bacteria, and you also have to address the health of the saliva. So if you don't have any saliva, you don't have any buffering capacity for the acids that are being produced by even a small number of bacteria, and you also don't have the dilution that goes along with it, and that can be addressed. The thing is that we in dentistry are, I don't know, we're hesitant about doing these kind of tests. We're afraid that you're going to say, oh, I don't want to spend all this money on these expensive tests. Well, really, if you're getting a lot of decay, you're getting a lot of holes in your teeth, finding out what's causing those holes in your teeth should be job number one. And part of job number one would be to check the health of your saliva. So there you go. Those are the kinds of questions to ask your dentist or your dental hygienist. What is my saliva like? Do I have a vast majority of cariogenic bacteria? What are we doing to address the bacteria besides this brush and floss lecture? Those are the kinds of questions that you need to ask your dentist and your dental hygienist. That's what I have to say about it. My name is Shirley Gutkowski. If you have any other questions, you can find me just about everywhere on the internet. My name is spelled Gutkowski, and I'm happy to be your patient advocate.